Hello, colleagues. Hello, friends. Good evening. Good morning. Actually, our greetings from Green World is good morning. So one more time, good morning. Good morning, colleagues. Good morning, friends. My name is Patrick Njoroge Mwaniki. I will be your presenter today. Today is 19th January 2024. I have the honor of being the presenter of today's Health Fellowship Hour. Today being the end of the day, I welcome the guests, I welcome the friends, I welcome the teammates from Green World as we go through this evening Health Fellowship Hour. Today, 19th January. We call ourselves the Versatile Team. Our location is in Naivasha, opposite Kenya Women offices. We are next to the famous Jambi Hotel. When you come to Naivasha, you go to Kenya Women, we are just opposite. Our meetings are scheduled every day, Monday all the way to Friday. We have the Healthy Fellowship Hour, Monday to Friday, at exactly 5:30 sharp to 6:30 sharp. We have our Healthy Fellowship Hour, and I've already said that I'll take you through that training for today. Every Wednesday at 10:00 a.m. in the morning, after you have taken your cup of tea, all the way to 1 hour after lunch, that is 2 p.m., we have our business and distributors training. Business and distributors training. You are welcomed on Wednesday immediately after your tea, 10:00 to 2 p.m. Our third module of meetings every day at 9:30. We have our Zoom training, but occasionally that can be changed to 8 at night. But we let you know whenever the Zoom meeting is at 8, but officially it's at 9:00 p.m. Immediately your loved ones, the children are in bed, and you are there with your family. You would log into the Zoom meeting at 9:30. Our contact, you can reach us through our phone call 0701 158 821. I can go through that once again. You can give us a call. Our office line 0701 158 821. You can call us, maybe a consultation, or maybe encourage us. We are live in Facebook. Our Facebook account is Versatile Next Level Team. Can I say that again? Our Facebook account is the Versatile Next Level Team. You can always log us and get us there live. Our YouTube account is Versatile Team, and we are live. For example, as I have this honor of bringing you this discussion, I want to believe that I'm live in both Facebook and YouTube. Thank you for that introduction. And today being a Friday, tomorrow is another great day. Tomorrow, Saturday, 20th, the Versatile Team, Naivasha, has organized a major expo. Tomorrow, Saturday, 20th January 2024, we have a business conference. Actually, we are calling it Naivasha 2024 Business Conference. The key speakers in tomorrow's conference, besides others, we have Mr. Mwangi Kirato, who is our chairman, our key speakers. We have our CEO, Madam Anne Joroge, as our key speakers. The venue, before I forget, we shall be in Westbourne Hotel, up there, Westbourne Hotel. When you arrive to Naivasha, you ask anybody It is next to Nakuru stage. Those mats that take people to Nakuru. Next to that, we have the Westbourne Hotel. We shall be there all the way from 10:00 up to 2 in the afternoon. The insights of tomorrow's Business Expo, Naivasha 2024 Business Conference, the insights we want to bring to you about successful investments. I wouldn't want to spill the beans. I'll just give you the highlight. Successful investments. We want to bring to you about the China trip, what you need to do to qualify. We want to talk about the compensation plan for Greenwald. We want to talk about the car awards. So we are appealing to you, keep time, be punctual, come with as many friends as possible. Let us invite our friends, let us invite our colleagues, let us invite our churchmates, let us invite those people that we work with, so that we take this business to another level. So welcome for that. Thank you so much for that introductory kind of discussion. And now I can go back and take you to my main topic of the day today. My main topic of the day today. Our company, Greenwald, has continuously made life better and better to us, and especially us men. The aspect of the wellness, the aspect of our health, the men. So today I want to bring to you this issue that cuts across most of the men, and especially those men who are 45 years and above. The Greenwald Prostasure capsule. Greenwald Prostasure capsules. Maybe Mike can just help me move the mouse a bit. Kindly help me move the mouse. So today we are going to talk about the pillars of our homes, the pillars of the country, that is men. And thank you for that. We know that issues of men, me being one of them, not many men go for health checkups in the hospital. I would actually call that some element of not being so much considerate about our bodies. But for this 1 hour, I'm gonna bring to you the issue of the prostate and all that. So to begin with, in our bodies, we know that when we eat food, the food that we eat has a lot of nitrogenous components. When it is digested in the body will retain whatever it needs, and everything else that is of nitrogenous origin is going to be passed out as urea in urine. So I have a brief diagram showing the urinary system in a human being. We know that when you talk about excretion, particularly formation of urine, we have two key organs in the body, and those are the kidneys. We have the right kidney and the left kidney. The diagram there, you can see the kidney there. We have one on the right kidney. We have another kidney on the left. These kidney are the ones that do the purification of the blood. Any excess nitrogenous products is going to be filtered from the kidney. So it's going to pass kidney. Then we go to a tube that we call the ureter tube. It carries now the filtered materials, either the urine from the kidney all the way to the bladder. Kidney, right kidney, left kidney, and the associated organs. Down through the ureter, you have the two tubes there carrying the nitrogenous materials all the way to the urinary bladder for both males and female. And then from the bladder, we have another tube that now takes that urine from the bladder, the storage, to the external source, and then we call it the urethra. So that is the brief introduction of the way the nitrogenous material, and I would want to simplify by calling it urine, the way it is carried all the way from the kidney through the ureter, urinary bladder, urethra, and then is going to pass out to the external world. A brief kind of a discussion there. Now, as far as now the man is concerned, you'll find that under the urinary bladder, there is a gland that we call prostate. There is a diagram there that shows the bladder, and immediately under the bladder there is a gland that we call the prostate. A normal prostate, a normal one, is actually a small gland. They are quite small. It is walnut sized. A walnut is a type of nut that is quite small, about it can carry about 20 cc of volume there. Okay, we have the prostate. Besides that, we also have some other glands there around the bladder. I mean the prostate area. We also have some other glands we call the seminal vesicles and all that. They are all under the bladder. I'm going to concentrate much on the prostate. So we have said this is a small gland. It is walnut shaped. Together with we also have the seminal vesicles. Now the two, they produce a fluid that we call the semen. Semen. In reproduction, we know that man is key, and the man is the source of the seed, the sperm. For the sperm to be transported all the way from the area of manufacture, that is the testis, it has to travel through the various tubes, and the time has to come when the seminal vesicles and the prostate have to together produce a fluid that now combines with the semen, and then it is ejaculated out as semen that contains the sperm. I'm saying my main discussion will be on the prostate, just located below the bladder, and it surrounds the urethra or the urine tract. Now, for us men, what happens? As we continue aging, age 45 years and above, 50 years and above, what happens is, sometimes because of, maybe because of our diet, maybe because of genetics, what we inherited from our parents, the prostate can undergo some kind of swellings. It may undergo some kind of swellings. In my diagram there, I have a diagram of, maybe I can go back a bit. We have a diagram of the normal prostate. You can see it is quite small, but I'm saying because of maybe age, diet, hereditary, whatever we, the genetical makeup that we inherited from our parents, the prostate can undergo swellings. And actually that's where now issues start arising now, when the prostate starts swelling and all that. If we follow the next diagram, we have already described what a prostate is. We have seen what a normal prostate is. It should be there, no swelling, serving its purpose of producing the fluid that accompanies the sperms, the seminal vesicles, producing its fluid that accompanies the sperms. Together we are calling it semen, at the right time for mating and all that. Now, if, for example, now we have now that complication of maybe inheritance from our parents, maybe, or because of the wrong diet, or because of maybe some as we shall see later, some mutation, the normal prostate gland gets what we call disorders. It doesn't function the normal way. Disorders, we call disorders and all that. So the first type of disorder that we have is what we call, the first prostate disorder is what we call the prostatitis. The first disorder that we have on the side of the prostate is what we call the prostatitis. What is prostatitis? Prostatitis, in short, is a swelling. The prostate starts swelling. It increases in size. Not just swelling. It also has what we call inflammation. Inflammation. What is inflammation? Inflammation is swelling. It starts getting to be painful. It starts becoming distressing. Initially, when we are 25, 30 years, that 5 years, we are strong and all that. At 45, 50, the first disorder unfortunately starts coming in. We are calling it prostatitis, and we are simplifying by saying that that is swelling, inflammation of the prostate gland. It becomes painful, and other complications start coming in, like difficult urination. I remember when we are maybe young men and all that, and you visited the washrooms, you could draw a very long jet of urine on the other side, isn't it? But as ages goes on, the jet becomes weaker and weaker and all that, difficult in urination because of prostatitis. We are saying that is swelling of the gland. Now there is a diagram showing us there that we have our prostate. Yes, we have the gland there. That's the normal one. And the swelling conditions, you can see that the prostate gland now has become bigger. It is already enlarged. Now, what are the symptoms that you are going to see for us to confirm or say that this is taking place? The various symptoms of swellings and inflammation. The first one, when you visit the bathroom, the man you are passing, you want to go for a pee, you want to pass the urine, there will be a burning sensation along the urethra. You want to pass the urine, there can be a burning sensation when you want to pass the urine. Something that you would observe for the first time, you have never had that before. It's a bit distressing. It makes somebody a bit uncomfortable. Now, whenever you have a burning sensation, it does not automatically mean that it is prostatitis. So maybe a medical doctor can help you differentiate which is which. Because if it could be infection, for example, infections from the sexually transmitted diseases, they could also cause that issue. That is one of the complications, burning sensation. Number two, the second one is you are used to a smooth flow of the urine, but now we have difficulties in urinating. Difficulties in urinating. What does that mean? You used to pass a very strong jet of urine from here to the other side, but now the urine is just maybe even just falling near the shoe there. Difficulties in urinating. You are very hesitant to visit the washrooms because it's gonna be painful. That is point number two. Note that one. Difficult in urinating is a symptom to show that things are not as they used to be. Number three, initially you used to sleep from maybe from 10 up to the morning, but now at night you have interruption and you want to wake up at night to go and visit the washrooms. That is frequent urination, particularly during the night. Unless you had taken so much fluid, you would expect that normally you would sleep throughout, but now if you find that you have to wake up at night, and even sometime the family might be concerned that the dad is waking up frequently, that could also be an indication. The next one, what we call the urgency. You want to visit the washrooms, But now you have to hasten, you go faster. There is that urge, you feel that the press is now too much. That is also an indication to show that things are not as they were before. That means that now the prostate gland is starting to enlarge, starting to swell, and all that. Okay, next one. Under normal condition, we expect that the color of urine should be clear urine to pale yellow. But if you go to the washroom and see that the color of urine is cloudy, meaning that it is a bit turbid, cloudy, tending to the color of some whiteness, like the color of milk and all that, that is also a clear sign that things are not going on very well. Maybe the clearest indicator that you have this condition of prostatitis is when there is now urine in blood. You go to the washroom and there is a stain of blood in urine. That could be a very clear sign. Other signs that you have this condition is when there is pain in the abdomen, pain in the groin and the lower back. You are not experiencing those symptoms, but now you are finding them again. There you develop that suspicion. When there is, for a man, below the testis, there's what we call the outer covering, we call the scrotum. Then between the male reproductive organ and the anus, there is a skin that we call the perineum, that is around the rectum there. That area there, if you find that there is some pain, again, that is an indication that things are not okay. Discomfort around the testes is another indicator. And okay, I think I am man enough. Painful ejaculations during copulation, that is another indicator. And lastly, but not of course, there are so many of them. Lastly, but not the least, when you have flu-like signs and symptoms with bacteria, all that is leading to now what we are calling prostatitis and all that. So the key point here is the first disorder, that the prostate gland is not functioning properly. The first one we are calling is prostatitis and all that, and simply said, that is swelling and inflammation of that gland. So as I go to the next disorder, note the normal prostate, small, firm. First condition of the disorder, it enlarges, it swells, it's painful, it is distressing, and you start seeing those symptoms that we have talked about. The second disorder that can get us the prostate, second disorder that we need is something we call the BPF, that is the benign prostatic hyperplasia. It's a technical word. Second disorder, the BPH, the benign prostatic hyperplasia. Now, this is now another level of the first disorder, where now we not only have the swelling, but the enlargement of the prostate gland. It enlarges in size. Initially, it was walnut shape, that size, a small nut. Now, it has swelled, it has enlarged. This is a condition now that is getting worse and worse, and especially for older men. As you advance in age, now you are 50, 55, you are heading to 60, and if no attention has been paid, it's gonna get worse and worse. So medically, we are calling it the BPH, the benign prostatic hyperplasia. The prostate gland is enlarging worse and worse. That means that more and more complications are setting in. If there is no intervention, it means it's getting worse and worse. What are the symptoms if you have this kind of a disorder? Number one, and the worst of all, there is a lot of discomfort during urination. You are very uncomfortable. The urinary symptoms have now been, they are bigger, they are exaggerated. You become very, very uncomfortable. There will be a lot of pain. There is a lot of urgency. There will be blood in the urine. You will wake up even maybe 2 times at night and all that. The conditions now are worsening more and more. There could be even something we call blocking of the flow of urine. We have said that urine is supposed to flow naturally, but under this condition, you will find that now the stream is weaker. That's now a complication, blocking of the urine. There can also be something we call retention of the urine, meaning that not all the urine is expelled from the bladder. A bit of it is retained and all that. Retention of the urine and all that. That means that there could also be infection backwards. Infection backwards from the urethra back to the bladder. Infection in the bladder. From the urethra through the ureter back to the kidney. Infection in the kidney. Infection in the urinary tract and all that. That could be an issue. Before I leave that again, we would check the diagram and see what we have there. A normal bladder, yes. A normal prostate gland there. You can see, very good looking. But now when we have the BPH, the benign prostatic hyperplasia, the prostate gland is already enlarged. It's already enlarged. Remember, there we also said that we have the seminal vesicles. Both of them very important in reproduction. The size of the prostate now has enlarged and all that. And we can even see the cartoon of a man there that has issues when he's visiting the washrooms. Very, very uncomfortable and a lot of pain because of that complication. So that is the second disorder as far as the prostate is concerned. Let's go to the third disorder of prostate. The third now disorder, now this one is now the worst of all. What we call now the prostate cancer. Prostate cancer. We began by inflammation, enlargement. Now we're in the third stage. We have the prostate cancer. Now, how does now this come about? In other words, this issue of cancer, we have various types of cancers, but if you would say that what brings about these issues of the cancer? Now we'd expect that in our bodies we have the normal cells that are dividing, multiplying, dividing normally. What we learned in school, the process of cell division, mitosis, and all that. But maybe because of maybe genetical, what we call mutation, the DNA, the wrong instructions are given to the cells. So instead of normal mutation, we have excess growth of the cells. Excess growth of the cells. Some of that. We know that some of the cells are being produced, others are dying. There could be some pathogens, maybe invasion, and that could be the genesis of cancer. What are we saying from the diagram? Our third disorder is the prostate cancer. Cancer begins when some cells in your prostate become abnormal. We have the normal cells, they undergo normal division. They get normal oxygen, normal respiration. But now when things become abnormal, some cells divide faster than the others because of maybe genetical issues, maybe because of mutation. That is the genesis of cancer, uncontrolled growth of cells. So from what we have prepared there, we have what we call mutation, abnormal cells, the DNA, because the cells to grow and divide rapidly than the normal cells, very fast. The abnormal cells continue living while other cells die. The normal cells, they grow, they are there, they are doing their part. But the other ones, they die. The pathogens can invade the source of cancer and all that. The accumulation of abnormal cells, they form a tumor. Very important. A tumor. Now we have a mass of cells that are there. Some of them are dead. They are producing toxins. Okay, and all that. They may invade even the healthy cells that are bordering now in that region. Some of the abnormal cells can also break off. You have abnormal cells, they are growing. They can break off and they travel in blood to other areas. I think they call it, medically, they call it metastasize. They metastasize. They are growing, they are abnormal, then they shift from this area to another area, and that is even worse. That could be the genesis of now cancer in our prostate. So as men, I think we cannot afford to be ignorant of our health, our wealth, our health. We see that if we look at the other side, the prostate that is in each man can develop to cancer, and now that could bring us more complications. We have an example here of a tumor, the enlarged prostate, both left and right. It's there. And something that now you would appreciate is that because now this prostate is just below the bladder, and the urethra passes right between the gland. When the prostate enlarges, when it swells, what does it do? It occupies more space. It's going to occupy more space. So the urethra, which is a tube now, is going to be pressed. It's going to be squeezed. It's going to narrow because it's now being pressed left and right because of the enlarged prostate. That is the one that now brings the complication during when you go to the bedroom. You want to pass urine, but it's taking you a few seconds before you start because now the urethra has already been squeezed by the enlarged prostate. Yes, you want to pass urine fast so that you go, you can't. As it gets worse and worse, even some of the urine might be retained in the bladder. That's what now we are calling the complications that comes about because of the enlargement of the prostate and all that. So before I go to the intervention that our company Green World has put in as far as the men are concerned, let's see what we have gone through so far. The disorders in the prostate for male. That when you are 45 years, 50 years and above 60, it is important that you take cognizance that there are chances that depending on the inheritance, your family line, depending on the diet that you take, depending on the lifestyle that you have adopted, the normal prostate that is under the prostate gland might undergo disorders, and there are three of them. We start with the first one, what we called the very first one, what we called the swelling and the inflammation. We called it what? The prostatitis. That's the first one, the swelling and all that, starting to bring complication. We go to the second one, stage 1, then stage 2, what we call the BPH, the benign prostatic hyperplasia, also called now the enlargement. It is becoming bigger and bigger, and you have said at its continuous swelling, a lot of discomfort, and the worst part is it is now putting pressure on the urethra. The rumen of the urethra is squeezed. I would think for a normal man, you would visit maybe the bathroom maybe 3 times in a day or 4 times, depending on the way you have taken your fluids now. So we expect a very functional urethra, able to carry the urine from the bladder through the male reproductive organ outside. Now, when it is pressed, that urethra, it is such an important route of passing the nitrogenous waste, the urine. When it's now being pressed, that is where now the complications begin. That's number 2. The third one is the prostate cancer. Prostate cancer, what are the genesis? Either because of the DNA, maybe mutation, the genetics is changing because of the family line, maybe because of differential division of the cells. Some cells are growing faster than the others. Some of the cells might die. Toxins in the prostate and all that. And then medically we have said that some of the cells, they form a tumor. Some of the tissue in the tumor can migrate from one region to the other, and we have called it metastasize and all that. Now we now want to go to the intervention of the Greenwald International Company in as far as the male prostate condition is concerned. Now we have now what we call the prostate care capsule. The prostate care capsule as now the first line or the immediate medical intervention, so that you take care, so that you don't go that route of the three disorders that you have seen. So Greenwald has come up with the prostate care capsules, and thank you for that. We have it right here with us. The big name, our magic company, the Greenwald, and you can see we are not leaving the Greenwald behind. You can see the logo there. Very nice, showing us the flowers and all that. So the Prostasure capsule, they are in this bottle. Very nice, you can see, very handy. Okay, very good looking. You can even be very proud as you put it on the table there, and you educate your friends, you educate your colleagues and all that. That is wonderful. So we have our tablets there, which is okay. Now these tablets that are in here have been formulated from various extracts that are organic. They have technical names. We have the first one there. Maybe I can just mention the first name. We have the radix extract. We have technical names and all that. The researchers have found that radix extract serves certain purposes as far as our prostate gland is concerned. There is a rhizoma extract, the second one there. There are so many. The cortex extract, I wouldn't want to read the technical names. There you have. We have the third one, the fructose extract. We have the herbal extract and all that. There are 5 of them. 1, 2, 3, 4, 5. And together with our scientists, they come up with our prostate care capsules. This one that we recommend that each man should educate himself about it, so that he doesn't go the route that we have gone through. Let's look at some of the benefits that are from this extract. The first one, the radix extract. This one, what does it do? It strengthens the kidney. What does that mean? It means that it enables the kidney to serve the purpose it's supposed to be served 100%. Okay, it enables the kidney to do maybe the filtration of the nitrogenous waste 100%. It enhances the adrenal glands around the kidney. It tonifies the blood. What is to tonify the blood? To tonify the blood is to nourish the blood, make the blood plasma. They're the composition. Support the blood. Supplement the blood. We know that you can lose blood maybe during an injury, maybe during childbirth and all that. So when we say that we want to tonify the blood, we are saying that you are supplementing the blood such that the blood serves its rightful purpose. So that is the first advantage of this extract. It strengthens the kidneys. The kidneys are able to serve their purpose. It enhances the adrenal glands. It tonifies the blood. The first extract. The second extract, we have the rhizoma extract and all that. What is the purpose of that in our medication here? It treats the urinary tract infection. If there are any infection around the urinary tract, this is going to counter those infections that are there. this rhizoma extract is going to counter any tract infection and all that. It's going to even to help in other areas. For example, the sore throat is going to make sure that you have a smooth throat there. Okay, the issue of our taste band. So it's not just about the prostate gland and all that. Even the throat is going to make sure that the throat is okay, the taste band in okay, and all that. So that's the second extract. The third one, we have the cortex extract. It's also found in our capsule there. The cortex extract. What function does it serve? This function serves the function of reducing now the kidney. It reduces the risk of the prostate cancer. Very, very important. I think all men should hear this, that we are all candidates of prostate cancer because of one reason by another. But to make sure that you don't go that route, go for this tab, that the cortex extract reduces the risk of the prostate cancer. Very, very important, the risk. We are not saying that we are 100% sure that we shall get the prostate, but you should reduce your chances of getting the cancer by practicing the correct lifestyle, by taking these tabs there. It's also going to help in the issues of the memory. As men, when you are sent to the supermarket, go and bring me these 5 items. When you go to the supermarket, the shelf, you only remembering 2. The other 3, you are forgetting. That is loss of memory. I think I'm not the only one. Even some of you, maybe you go there, you have already forgotten. Memory loss. So if you want to bring the harmony at home, whatever you are sent, you are able to recall all of them. Make sure that you go for these that tabs. Not just that, it also is used to treat what we call osteoporosis. Osteoporosis now is when the bones, they become weaker and weaker because of loss of calcium and all that. It helps also to reduce the stress. Men, we have so many stress because of you have challenges of providing for the family. You want to maintain a certain lifestyle. Stress levels are high. Go for this capsule. It's going to help. The third extract, what we are calling the fructose extract, this one is used to tonify the liver. What have we said is to tonify? To tonify is to strengthen, to nourish the liver. The liver is the key organ in our bodies. The liver. Whenever all the foods are eaten, they are first of all taken to the liver. The fats, the carbohydrates, the protein, and all that. So we want to fortify the liver. We say you tonify the liver. Tonify the kidney. Make the kidney functional for it to do the excretion purposes and all that. It improves eyesight. The fructose extract. It improves the eyesight, that you are able to see there and all that. The issues of either short sight or long sight should not arise when you take these extracts and all that. We have another extract there that we are calling the herbal plantaizis extract. Again, this one helps to make our liver and kidney healthy. Know that. And the keyword that we are using here is to tonify the liver and the kidney. To support the kidney, to support the liver and all that, to supplement their function and make them firmer, smoother, and stronger. Function of these benefits of the ingredients that are found in the Prostasure capsules and all that. Very, very, very important. And we are saying they are organic in origin. They are not chemicals. Greenwald scientists are able to extract the active ingredients and then put it in a specialized package, and here we are, so that each and every man is assured of a decent life. Now, let's go to the next item, even as I move on to conclusion. There is the health benefit of the Prostasure capsule. What are the benefits when you take these tablets as part of your lifestyle. What are the prostate care capsule benefits? Number one, you prevent the prostate disorders, and there are 3 of them. You are going to prevent those disorders, or at least you are going to reduce their level of the effects they are going to have on their body. The prostatitis, that is the swelling, the BPH, the enlargement, and of course the cancer, the prostate cancer. So those 3 disorders, their effects are going to be reduced when we take these capsules. Very important. The second one, we have seen so many symptoms of someone who is having the prostate complications. Symptoms like waking up at night, urgency of passing urination, blood in urination, complications during ejaculation and all that, discomfort, even wetting your trouser. We can generally say that this disease reduces the self-esteem of a man, isn't it? It reduces the self-esteem because there you are at the washroom. You don't want to take a lot of fluids because you have to visit the washroom all the time. So to relieve the signs and symptoms of prostate enlargement, we go for the prostate care capsule. Very, very, very important. And I'm repeating again, if you are a man, after this presentation, come for this bottle. This bottle is going to change the quality of your life. Whether you have the complication or not, it's going to change your, as men, we always want to act tough and all that. But when you go down in health, that's the time now you start asking, where did things go wrong? Eh? So before you get there, Greenwald has given us this magic tabs capsule, come from them. The third benefit of the prostate care capsule, it improves blood circulation. Wow, this is very, very important. Blood circulation. Now, we know that blood carries oxygen all the way from the lungs to the heart to the various organs and tissues where the cells require the oxygen, glucose for utilization, and then after that, the gas that we call carbon dioxide is taken out again to the lungs, and then it is expelled out. When we talk of improved blood circulation, we are saying at no time will you faint because the blood is not getting to maybe to the brain. There is no time your hands are going to be numb because the blood is not getting to your hands. There is no time you shall not have nervous coordination because blood is nourishing all parts of the body. The kidney need a lot of blood, as we have said. Blood circulation or improved blood circulation is such an important aspect of a human being. So you take the medication, you get that advantage, improved blood circulation. Not now, I can say that everybody needs enhanced blood circulation. The man, the babies, our women, people at places of work, everybody needs enhanced blood circulation. Very, very, very important. The third benefit of prostate care capsule is that we are able now to check on what we call the pathogens that could be in the body. Actually, in the body, we are at a danger of being attacked by pathogens. Specifically, the pathogens could be some disease-causing bacteria, acute bacterial prostatitis. For example, there is a very pathogenic bacteria that if it gets you, and especially in this vital organ, the one we call Escherichia coli, the Pseudomonas species of bacteria, they are all scientifically, they are all gram positive. And the scientists would understand what that means. When their testing is either gram positive or gram negative. All of them are gram negative. I've said the Escherichia coli, the Pseudomonas species, all of them, they are pathogenic microorganisms, and they could be key in exaggerating the 3 effects that we have seen. So when you take this medication, you are going to restrain, you are going to interfere with the growth of this microorganism in the inflamed region, in the inflamed prostate. There is restraining, you restrain their growth, the growth of this pathogenic bacteria, very bad bacteria and all that. We are saying people just shorten and say that the E. coli bacteria, the Pseudomonas species, they are gram-negative bacteria, and they could accelerate the effect of the cancer, especially that part. To prevent that, make sure that you have these tablets that we have with us here. I want to end up by looking at how to use this prostate care capsule and all that. How do we use it? We have already said that it is the men who need that. How do we use it? Okay. All along we have been carrying a photo of a man there with a newspaper, and right now we have already internalized the name of our tablets is the prostate care capsule, prostate cure capsules. Now, somebody was telling me that sometime when you have these conditions and you go to the washrooms, and especially out there, and you wet your trouser and you would want to cover. So if you're having a newspaper and you see somebody passing it around there, they are trying to cover up the effect of now they have wetted the trouser. So we don't want to go that route. So you see our man there reading the newspaper and taking a cup of tea, but you don't know the discomfort he's going through if he has this complication. How do we use this prostate care capsule? It is suitable for men with any of the prostate care disorders, the 3 of them. Men who are above 40 years, now the years have gone down. We used to talk about men who are 50 and above. Now we are talking about men who are 40. Imagine 40. When life is beginning, life begins at 40. When life is beginning, the issue now comes up now. I don't know whether you enjoy life. So Greenwald is ensuring us that you can enjoy life if you were to make these tabs your friend. Make them your friend. You are going to enjoy life. You are going to reverse the effect of the 3 disorders that you have talked about. When our doctor checks on you and all that, he's going to recommend mainly you take 2 capsules in a day, maybe in the morning and all that, twice in a day. That is now going to ensure that the quality of your life is better and better. So with that, I would say that as men, yes, men, despite the challenges that we have there, we should not enjoy, rather we should not fail to enjoy quality of life because of such unfortunate disorders. Come for this medication again and all that. So as I finish, as I wind up, we just want to remind you that tomorrow we want to take this issue of training, not just what I want to talk about, more and more. Tomorrow, Naivasha, we are having a major expo. We are calling it Naivasha 2024 Business Conference. We are going to be located in Westbourne Hotel. Westbourne Hotel is near the stage there, the Nakuru stage. You are welcome. Our key speakers, as I had said earlier, we have Mr. Chairman here, Mr. Mwangi Kirato. We have Madam Anne. And jointly, we are versatile. Versatile means that we can fit depending on the situation and all that. You are welcome. Our discussion points, we want to talk about investment, and not just small investment. We are talking of investment that can surpass your regular job. It can surpass your regular job. You can do it part-time, you can do it full-time, and earn good money. Okay, enjoy life. I think that is what God intended us to do. So the issues of successful investment tried, promised yesterday, today, and even tomorrow. That will be one of the points. Point number 2, you want to talk about the way you are motivated by the team, the compensation by the company, the compensation plan. How do you get into this kind of a marketing model? You want to talk about even traveling internationally, the China trip. You want to talk about other bigger motivation than the car motivation, besides the other issue. So as I finish, I think I have rushed through the topic, but remember this, man, kindly enjoy the quality of life by coming for these tablets. So thank you so much. Thank you so much. Yes, these tablets is available in our offices. Where did you say we are located? We are located in Naivasha, opposite Kenya Women Offices, next to Jambi Hotel. These capsules are here. You will get us in the offices. You come, we do consultation. You are a man, come with your friend. Let's be assured that our 40 years and above, that we are not going through this complication of prostate and all that. As I finish, we said that we have Mondays every day, 5:30 to 6:30, the fellowship hour. Every Wednesday, we have business distribution training from 10:00 a.m. to 2 p.m. And every day, we have a Zoom meeting at 9:30. You can reach us immediately using our office line 0701 158 821. We are live in Facebook account, The Versatile Next Level Team. We are also live in YouTube, The Versatile Team. Thank you so much, Greenwald. Thank you so much, colleague. Thank you so much. God bless you much. Thank you so much. Karibu sana.